Welcome back to Mangevity, where we tackle men's health topics that matter but don't get talked about enough. I'm Simon, and today we're discussing something that affects up to 30% of men at some point in their lives, but rarely gets honest, practical solutions. We're talking about premature ejaculation, and more importantly, how to fix it. If you've struggled with finishing too quickly, if it's affecting your confidence or your relationship, or if you simply want better control, this video is for you. Today I'm breaking down the complete ejaculation control protocol, behavioral techniques, medical options, and training methods that can help you go from 2 minutes to 20 plus minutes. These are evidence-based strategies that actually work. Before we dive in, quick disclaimer. This is educational content based on research and expert recommendations. Always consult with a healthcare provider before trying any medical treatments. And if you find this helpful, hit that subscribe button. We're building a community of men who want to optimize their health without the stigma. Let's get into it. 1. Understanding the problem. What is premature ejaculation? First, let's define what we're dealing with. Premature ejaculation, or PE, is generally defined as ejaculating within 1 minute of penetration, though many men experience distress when it happens within 2 to 3 minutes. Here's what's important to understand. This isn't just in your head. There are real physiological and psychological factors at play. The main causes include 1. Biological factors, hypersensitivity of the penis, abnormal hormone levels, inflammation or infection of the prostate or urethra, and genetics. Some men are simply wired with a more sensitive ejaculatory reflex. 2. Psychological factors, performance anxiety, stress, relationship issues, depression, or even guilt about sex from past experiences or upbringing. 3. Learned behavior. If your early sexual experiences were rushed or secretive, your body may have learned to climax quickly as a pattern. The good news, whether your PE is lifelong or acquired, whether it's biological or psychological, the protocol we're about to cover addresses all of these factors. And here's something most guys don't realize. Ejaculatory control is a skill. Like any skill, it can be trained and improved with the right techniques. So let's break down the protocol, starting with behavioral techniques you can start using today. Technique number 1, start-stop method. The start-stop technique is the foundation of behavioral training for ejaculatory control. It was developed by sex researcher James Siemens in the 1950s, and it's still one of the most effective methods today. Here's how it works. Step 1. Practice with your partner during sex. As you engage in sexual activity, pay attention to your arousal level. When you feel you're approaching the point of no return, the moment when ejaculation feels inevitable, recognize it. This is usually around a 7 or 8 on a scale of 1 to 10. Step 2. Stop all stimulation immediately. Pause completely for 30 seconds to a minute until the urge to ejaculate decreases. Don't just slow down. Fully stop movement and allow your body to calm. Step 3. Resume sexual activity once you feel more in control. Repeat this cycle 3 to 5 times before allowing yourself to finish. The goal: you are training your brain to recognize different stages of arousal and teaching your body that it doesn't need to rush to climax. Over time, this builds awareness, confidence, and greater control during sex. The start-stop method has about a 60-70% success rate when practiced consistently. It's free, it has no side effects, and it gives you skills that last a lifetime. Technique number 2, the squeeze method. The squeeze method is a variation developed by the legendary sex researchers Masters and Johnson. It adds a physical component to the start-stop approach. Here's the technique. Step 1. When you feel ejaculation approaching during stimulation, stop immediately, just like the start-stop method. Step 2. Apply firm pressure to the head of the penis. Specifically, place your thumb on the frenulum. That's the V-shaped area on the underside where the head meets the shaft. And place your index and middle fingers on the top side of the penis, just above and below the ridge of the head. Step 3. Squeeze firmly for 10-20 seconds. This should reduce your arousal and delay ejaculation. It might feel slightly uncomfortable, but it shouldn't be painful. Step 4. Wait about 30 seconds, then resume stimulation. Repeat the cycle 3 to 5 times before allowing ejaculation. Why this works? The squeeze temporarily restricts blood flow and stimulates nerves that send signals to delay ejaculation. Some researchers believe it also activates a reflex that reduces arousal. No. 3. Pelvic floor training. The game changer, pelvic floor training. Here's the method that doesn't get enough attention but might be the most powerful long-term solution. Pelvic floor muscle training. Your pelvic floor muscles control ejaculation. Specifically, they contract during orgasm to expel semen. But here's what most men don't know. These muscles can be trained for better control, just like any other muscle group. Understanding your pelvic floor. These are the muscles you use to stop urinating midstream or to hold in gas. That's your pelvic floor contracting. But there are 2 skills you need to develop: the ability to contract these muscles, tightening, and the ability to relax them on command. The training protocol. Step 1. Identify the muscles. Next time you urinate, stop the flow midstream. Those are your pelvic floor muscles. You can also tighten the muscles that would stop you from passing gas. Don't tense your abs, thighs, or buttocks. Isolate just the pelvic floor. Step 2. Kegel exercises for strength. Contract your pelvic floor muscles, hold for 3 to 5 seconds, then relax for 3 to 5 seconds. Do 10 reps 3 times per day. Gradually increase the hold time to 10 seconds. Step 3. Reverse Kegels for relaxation. This is crucial and often overlooked. A reverse Kegel is gently pushing out with your pelvic floor, like you're trying to start urinating or release gas. Hold this relaxed, slightly pushed out position for 3 to 5 seconds. Do 10 reps 3 times per day. Step 4. Apply during sex. Here's where it gets practical. During sexual activity, when you feel arousal building, contract your pelvic floor firmly for 5-10 seconds, regular Kegel. This can help delay ejaculation in the moment, or if your pelvic floor tends to be tight, do a reverse Kegel. Consciously relax those muscles. This prevents the involuntary clenching that can trigger early ejaculation. Which approach is right for you? If you have a weak pelvic floor, regular Kegels help. If you have a tense, overactive pelvic floor, reverse Kegels and relaxation are key. Advanced technique, pelvic floor biofeedback. Some physical therapists specialize in pelvic floor therapy for men. They can use biofeedback devices to show you exactly what your muscles are doing and teach you to control them better. This is incredibly effective but underutilized. The complete protocol. Putting it all together. The complete protocol. All right, let's put this all together into an actionable protocol. Weeks 1-4 foundation phase. Start pelvic floor training. 10 regular Kegels and 10 reverse Kegels 3 times daily. Practice start-stop technique solo 3 to 4 times per week. Focus on arousal awareness and breath control. Consider topical anesthetics if you want immediate help during this phase. Weeks 5-8. Integration phase. Continue pelvic floor training, increasing hold times. Transition start-stop or squeeze method to partner sex. Begin applying pelvic floor techniques during sex. Contract or relax as needed. Weeks 9 to 12. Optimization phase. Reduce reliance on topicals if you're using them. Focus on maintaining control without external aids. Fine-tune pelvic floor control during sex long-term maintenance. Keep up with pelvic floor exercises 3-4 times per week. Use start-stop as needed if you notice control slipping. Stay aware of stress and psychological factors. These can regress your progress. Additional tips for success. Communicate with your partner. This journey is easier and more successful when you have support. Manage performance anxiety. Sometimes the fear of PE causes PE. Consider therapy or counseling if anxiety is a major factor. Focus on whole body health. Exercise, sleep, stress management, and avoiding excessive alcohol all impact sexual function. Remember, there's no shame in seeking help. Consider seeing a urologist, sex therapist, or pelvic floor physical therapist if you need professional guidance. Let's recap. Premature ejaculation is common, treatable, and nothing to be embarrassed about. Your action steps. 1. Start with behavioral techniques. Start, stop, and squeeze methods. 2. Begin pelvic floor training, both strengthening and relaxation. 3. Consider topical solutions for immediate relief while training. 4. Be patient and consistent. Real improvement takes 6 to 12 weeks. Ejaculatory control is a skill. With the right techniques and commitment, most men can significantly improve. If you found this helpful, subscribe to Mangevity for more evidence-based men's health content. Drop a comment below with your experiences or questions. I read them all. And remember, optimal health includes sexual health. There's no shame in working on this.